Welcome to this podcast on Nevoid melanoma. Nevoid melanoma represents a variant of melanoma which is histopathologically easily mistaken for a nevus, and it's sometimes a retrospective diagnosis made after a benign nevus recurs or metastasizes. The IDS study evaluated nevoid melanoma histopathologically proven, and clinical aspect, colors, and global dermoscopic aspects were considered. In the final study, 27 nevoid melanomas were finally included. There was a slight predominance of male sex. The majority were located on the trunk, followed by upper and lower limbs and head and neck. And nevoid melanoma typically were nodular lesions, followed by plaque and papule. Concerning the distribution of color, the majority of nevoid melanoma were light pigmented, with red lesions in 30% of cases and just 2 cases with blue color. One of the category of nevoid melanoma is the ones looking like nevus. Before looking at the nevoid melanoma of this category, we should keep in mind how an intradermal common nevus look like. And here you see an example of a typical intradermal nevus that is a banal-looking lesion, soft at palpation, pink-brown in color but never red, with a long-standing history and typically located on the head and neck and upper trunk. And here you see some examples in dermoscopy with nevi ranging in color from light brown to completely melanotic with hairs and remnant of cobblestone pattern. Here we have 3 different examples of lesions. On the first case on the left, with this shiny surface and the symmetry from the clinical perspective. The second that is flesh-colored, and the third with this, again, shiny surface. But if we look at the dermoscopy, we see that the first case on the left showed a typical vascular pattern, whereas the second, it's barely showing some vessels that are not scary at all. And in the third case, we have blue dots and translucent areas typically findings of BCC. So dermoscopy helps to tell us that the first is a melanoma, Nevoid-like, the second is an intradermal nevus, and the third a BCC. And here we have another couple of examples. On the left, clinical, we have again a nodule with this shiny surface, and on the right side, clinically, we have a lesions with this dark brown color, but without any shiny surface. And dermoscopy reveals the first case being with this blue color, and at the base we have structureless areas and the typical network, whereas on the right side we have the typical cobblestone pattern of an intradermal nevus. Furthermore, if we have the possibility to touch those lesions, we can clearly tell that the first lesion is hard, firm at palpation, whereas the other is soft. And one is nevoid and the other is an intradermal nevus. Another example here with a clinical view of an isolated nodular small lesions that in dermoscopy reveals the presence of a homogeneous color with blue and brown, but the most important clue is located at the base of this nevoid melanoma that reveals streaks, peripheral streaks. The second category of nevoid melanoma is the melanotic tumors, in which we have here one example of a very large plaque showing some remnant of pigment, dotted vessels, and crystalline structures. And here another more difficult case of nevoid melanoma with these very large in size nodules located on the back of this 70-year-old man. And dermoscopy, the only clue is the presence of dotted vessels haphazardly distributed through the tumor. And if we look closer, we see also that there is at the base, at 5 o'clock, the presence of a tiny remnant of pigment. Another case of nevoid melanoma that appears as a papule on the leg, and dermoscopy reveals a typical vascular pattern with vessels ranging from corkscrew to dotted vessels to linear irregular, and the presence of asymmetrically located bluish areas. And finally, the third type is the multi-component nevoid melanoma with this multi-component pattern that is easily diagnosed under dermoscopy, because here we have all the criteria that we know for superficial spreading melanoma. So there is no doubt that this is a melanoma in dermoscopy. We cannot distinguish features specific for nevoid melanoma diagnosis, and maybe it's more difficult for pathologists to make the diagnosis of melanoma compared to our dermoscopy examination. And to conclude, nevoid melanoma can be with this nevus-like appearance, very difficult, but combining clinical and dermoscopy together, we are able to catch the beast. And in this case, we have irregular dots and globules, sometimes multiple milial axes, dotted vessels, and the typical vascular pattern. The second type is the melanotic nevoid melanomas, in which the vascular pattern is the predominant pattern that help us to recognize them as tumors. And the third is the multi-component nevoid melanomas that are easily diagnosed because they reveal the blue-white veil, irregular pigmentation, and other clear-cut diagnostic features. And all the criteria and the aspects can be found in the publication of the International Dermoscopy Society study published on the British Journal of Dermatology a few years ago. And thank you so much for your attention.